Good afternoon, everyone. We're experiencing some technical difficulties trying to get this up and running, so thank you for bearing with us. Let me just put this. So welcome to FIVF's fertility question and answer session about coronavirus and fertility. I want to welcome everybody. I would be remiss if I did not mention that this week is Infertility Awareness Week, and so 1 in 8 couples do struggle with infertility, and this is our week where we get to be acknowledged and everybody. There are lots of events and things, and so I just want to make sure that we receive the recognition that we deserve. All right, so as I'm sure all of you are well aware, we are currently experiencing a pandemic due to a novel virus called the coronavirus. And how that's affecting our daily lives and all aspects of our lives is really all intrusive, right? And so for fertility patients especially, on March 17th, ASRM, which is the governing body of reproductive endocrinologists across the U.S., put out a statement and guidance recommendations that really halted fertility treatment for the immediate future. Their recommendations were that patients that were in cycle that were currently being stimulated were able to continue. However, they recommended, due to the coronavirus pandemic, that we stop all new stimulations and not proceed with embryo transfers. And those recommendations really were twofold, right? So the first thing is that as the virus started to spread within the United States, we needed to promote social distancing, right? We needed to make sure that we were being cognizant of who we were exposing ourselves to and who we were exposing, and also trying to promote patients staying at home and not accessing the healthcare system that was under extreme burden, right? In addition to that, medical resources are a finite number at this point, and as we're trying to still produce more and keep up with the supply and demand, when you undergo treatment, whether it's gloves, mask, IV equipment, different things, anesthesiologist, doctors, all of these things, like you end up using medical resources that needed to be allocated elsewhere. And so for those reasons, ASRM came out with these very strong recommendations. And so as a practice, Fertility and IVF Center of Miami has followed ASRM's recommendations, and we treated the patients that were in cycle, and we stopped treating patients that were scheduled to start. We delayed them for a little moment in time. And so my staff and myself and the other doctors, we've all been receiving so many questions and concerns, and I just wanted to make sure that we were addressing them and that people were able to get their questions answered. So I made a list of the most frequently asked questions that I've been facing, and I'm going to answer those, and then I'll give it a go with trying to figure out how to use Instagram Live and respond to your individual questions, okay? And so I talked a little bit about ASRM's guidance statement, and then, so where are we today? As of the numbers from last night, Florida as a state has 27,000 cases, a third of those cases being in Miami-Dade County. This is important for us to know because we are in South Florida are really driving the Florida numbers, right? And so that was part of the reason why we as a center decided that it was really important that we follow ASRM's recommendations, because we did not want to add to the problem, and we did not want patients to end up being like what we were seeing in the Northeast. We wanted to try and prevent as much as we could patients being infected and getting infected. And so but we're seeing a stabilization kind of in the numbers. The numbers aren't going up quite as fast. And so we day to day are evaluating all of these things, and we're constantly watching for updates from ASRM, and we're making plans on how, when we go back to normal life, how that's going to look. And we are eager to join you guys and get back to where we were and what we were doing. Okay, and so please know that the delay is not malicious intent. It's really, we're trying to do no harm, and we're trying to make sure that we're providing the safest, best care for our patients possible. All right. So in March also, Governor DeSantis had put for elective surgical procedures to be put on hold. And again, that was in the same thought process of what ASRM was putting out. It all came out the same week, that we really shouldn't be doing cases that are quote unquote elective. Now, the question I get most from patients is infertility really elective? Well, no, of course not. Nobody would elect to be infertile, right? Nobody wants to be part of this club. And so it is not elective, and we get that, okay? And we're not trying to put up obstacles and barriers to care. But there is a difference between medically emergent and non-emergent. And so for patients that are facing cancer treatment or needed to go through right away for medical reasons, of course those patients are accommodated. But for most of our patients, that means that we're really putting a hold on stimulating for the month of April. Now, as we go into May, we're reevaluating how that's going to look, okay? And so as the days go by, we're in constant communication with the anesthesiologist, with ASRM, with public health officials, and what the best way for us to move forward is, right? Because we're going to have to coexist with this virus for a long time. It's not going away, and we are not going to stop treating patients. And so we just need to figure out the best, safest way to keep our patients safe and healthy and give you guys the outcome that you want. Okay, so that's the IVF answer. Now for the surgeries, for the majority of things that we do, like endometrial polyps and ovarian cyst and things like that, those things are not medically urgent, and so those surgeries have been put on hold. The surgery centers, and that's not based on what we wish, that that the hospital, the surgery centers, they also are following these rules. And so I have received a few emails from the different hospital systems and surgery centers in Miami-Dade that we have privileges at, and it looks like probably beginning of May will start, as long as Governor DeSantis does not extend his hold on elective non-urgent medical surgeries, that beginning in May we should be able to start scheduling those procedures. Now again, when we go back to scheduling, it's going to be different. They're going to have to promote social distancing, and there's going to be limited number of cases, and there's going to be, so it's not going to be 100% what it was in March or February, but we're going to do our best to get everybody taken care of as soon as we can. All right. Now, the next question I get from patients often is, will postponing treatment affect my ability to have a baby? And there is no evidence that delaying treatment a month or 2 months, even for patients with severe diminished ovarian reserve, is going to preclude them from being able to conceive, okay? There's nothing magical about the month of March versus May or April versus June, okay? And so for those, I just want to reassure people, I know that you've been on this journey for a long time, and you've experienced all of these things, and every delay seems like a boulder that's put in your path. And so, but I want to make sure that you know that doesn't necessarily negatively affect your chances of pregnancy, okay? The next question that the patients also ask is it safe to proceed? Should I delay because of the coronavirus? And so currently the information that we have about coronavirus is very limited. It's a novel virus, right? So patients, we don't have great data on all of this. And so the data that we do have is from starting in China, where the virus originated from. There is a small case series of patients in the 3rd trimester that were infected, and there was no evidence that their babies had active virus when they were born. So that's a good thing. However, there has been a report since then of a newborn that tested positive. Whether that baby tested positive because the mom had it and it was transmitted via vertical transmission, which is the medical term when mom passes it to baby in utero, versus it happening in the immediate newborn period with a healthcare worker, the mom handling the baby afterwards, and that's how it got infected? We don't know. So the answer is we don't know if the virus can be passed from mom to baby, but it doesn't seem to be. And the other thing we do know is that those babies that were born from the third trimester infection didn't have any birth defects. Now, usually you would expect the earlier infections, like first and second trimester infections, to be more associated with birth defects. And so the patients in China that were pregnant, in December and January when this all started, haven't had their babies yet. And so we don't know the incidence, but it doesn't appear to be. It's not like Zika was in 2016 where there was a definite birth defect that was associated with the virus that we were seeing, okay? And so it seems to be reassuring from that standpoint. Now, anytime you have a severe respiratory illness in a pregnant patient, of course, there are consequences to that. So not specific just to coronavirus, but from SARS, MERS, other like viruses. If a patient contracts those viruses early in pregnancy and has high fevers and has, severe respiratory compromise, things like that, it can affect the pregnancy. They're more at risk for pregnancy complications, preterm delivery, miscarriage, things like that. And so obviously if you're undergoing treatment and or are pregnant, you need to be very, very vigilant about, I shouldn't have just touched my face, cardinal rule, right? You should be very vigilant about not being in contact with people that are sick, wearing your mask when you're out and about, promoting social distancing, washing your hands, not touching your face like I just did, and things like that. All right. And so the next question that patients ask me is, well, what if I just want to start treatment? Like what happens? Like what's the worst that could happen? What's the risk of me starting treatment? Well, so there are a lot of things that are out of our control at this point. And so if Miami-Dade County or state of Florida issues a lockdown where because the numbers get out of hand or for some reason we're unable to come to work, then that would basically cancel your cycle. If you ended up contracting the coronavirus, God forbid, during your cycle, we would have to then cancel the cycle because the risk for you and for the staff and for everybody that you come into contact with when you're symptomatic and shedding virus, then that would mean that, not only is it time lost, but money and the emotional, considerations and all of that about canceling cycles. And those things are not small by any means, right? And so each part of this journey has its own trials and tribulations. And so we're trying to minimize those risks, right, as best as we can. And so, what other questions have people asked me? So we talked about the risk of starting treatment. Oh, and so if your cycle gets canceled, then what does that mean? So then we have to restart the cycle, the next month or the following, re-prepare you the following month and then start it the month later. And so it's delays in cycles and money and time and emotional, the burden of it all. And then, patients have been asking, is it safe? Are my cryopreserved embryos or my frozen eggs or sperm, are they safe? And not to worry, our embryologists are great babysitters, and they're doing a great job. And there's no risk. Your embryos are currently frozen and safe, and there's nothing at risk for them. Okay, and we're now looking at when patients start to cycle through, patients that are at risk or and have been infected with coronavirus, and how that will look for how we store their tissues. The FDA has recommendations for all of these things, and we closely follow all of their recommendations. And so, again, that's part of the moving forward from all of this and how we coexist with this virus and what we're going to do for looking at how we move forward. Okay. Other question that's really a hot topic is, what kind of testing can you guys do to make sure that I'm not going to contract this virus, right? And so this is a huge topic. I'm sure if you've watched the news, you're getting inundated with, questions about testing. But I'll kind of break it down into two parts. So the first test that everybody has been trying to seek out right now is the active viral test. It's a PCR test looking at the virus to make sure if people have active virus in their system, right? And so that's the test that everybody's been kind of looking for to see if you're infectious. All right, and that tells you you're infectious at this point. The next test that everybody has been talking about and is in the pipeline, but not currently. I think there are 4 FDA approved tests, but there are lots of people working on this, is something called antibody testing. So when we are exposed to a virus, our immune system makes a response to that virus. And the part of our response is making something called antibodies. And so this antibody testing is testing for different antibodies to see if you've contracted the virus and if you have an immunity to it. Now, the first thing is that the coronavirus, COVID-19 is a specific strain of coronavirus, right? So it's a disease or an illness that comes from a specific strain of coronavirus. And so we need to make sure that the antibody testing is not testing for all coronaviruses, because some coronaviruses are like the common cold and not really a big deal. But then this is clearly a very different situation. And so you want to make sure that you're testing for antigen or antibodies for this specific strain. Now, in addition to that, it takes a while for you to mount an immunity, right? So if I get infected with coronavirus today, I won't show antibodies for weeks. And then the different type of antibodies take longer than others. And so just because you don't show antibodies today doesn't mean that you haven't been exposed or you don't have it. And then once you show antibodies, what does that mean for you? Does that mean that you won't be able to contract the virus again? You know, once people are vaccinated against a virus or have been exposed to a virus, you hope that when you come to face that virus again, will have an immunity towards it, right? But whether that immunity is a whole immunity where you can't get infected and become sick again, or if you get a less virulent or less severe type of symptoms the second time, or if the virus mutates, because that's what viruses do, right? The influenza virus is constantly changing, and we try and predict which strains are going to be the positive strains for this year, and that's what they make the vaccine for. But some of that stuff it's all guessing. Scientific guessing, I guess, right? And so we don't know what the immunity will confer, but it's the best that we've got at this point. So the 2 tests that will be available are PCR testing for the virus as well as antibody testing. How those are going to be integrated into practice remains to be borne out in how we will proceed, whether we test everyone or we just test patients that are going transfer, things like that. So stay tuned. There will be more information with all of that. And then the last question that patients have really been asking me quite frequently is, this whole journey is really hard, and what kind of resources do you guys have other than me going on the internet and watching the news? And so there are lots of different ways to help cope with the stress of infertility, especially in the given climate. There are some great apps that you can download for free now because of everybody being in quarantine and at home and isolated. The Headspace app is now free for you to download through your app stores. There are support groups. There's a support group here in Miami called Miracles Over Miami. It's going to have a virtual support group this week. So you can look on their Facebook page, and there will be a Zoom call that will be organized. And so for anybody that is interested, that will be available. And then there's, reproductive psychologists. We have some really great ones here in Miami-Dade County, and they're offering virtual appointments. And so I highly recommend that if that's something that you feel you need, you reach out, and I'm happy to put you in touch with anybody I can. And then, finding your tribe, finding your people that can help you navigate this, your support system also. You have to nourish all of those things during this process. And so Those are kind of the questions that I've most recently been hearing a lot of. I'm going to try and turn on the questions now and see if you guys have any questions. All right. Can you see? Does anybody see? Can anybody put a question? Just so that I... Let me... All right. All right, well, I don't see any questions. I mean, you guys don't want me to start singing and dancing, do you? And so when it comes to treatments for all of our patients, please follow us on social media, follow on our Instagram accounts as well as our Facebook pages, and look for some updates here in the very, very near future, helping or posting about our plan moving forward. We've got some great plans for everybody, and we look forward to having our family back together again as soon as possible. We miss all of our patients so very much, and so we want you guys back here in the office. All right. The next ASRM update will be next Monday. They should release an update, and so we will post our response to that update on our social media, so look for that. ASRM has already hinted that they're leaning towards the reintegration process and how we move forward from that, and so we've had some webinars and different chats and things, and so I do foresee that this is going to be opening back up here in the very, very near future. Let me see. I have a question about COVID, testing prior to beginning treatment. So currently we are not a testing site. As the antibody testing becomes available and it's a reliable test that's FDA approved, this may be something that we will be offering. What we are doing for all of our patients is we are monitoring for symptoms, we are screening temperatures, and making sure that the travel history, the exposure history, all of that stuff is done. We're also limiting visits during the day, so we're not having crowding in the waiting room. We are making sure that patients are spaced appropriately, that there's time in between, so that we don't have patients just standing around waiting, being exposed. All of the sanitary stuff in the office is being done, extreme cleaning in between all patients and wiping down of services and all of that. And so as soon as I have an answer about what our COVID testing for patients will be, I'll do another one of these and I'll post it. How safe is it to go through infertility treatment now? So this is a great question, right? And so ASRM's recommendations were really, from best as I can tell, were really to promote social distancing and allocation of resources. There's no evidence that coronavirus is in the sperm or the eggs, or that being pregnant in this time period increases your risk of congenital defects, like I said before. However, anytime you're accessing medical care and you're leaving your house and you're coming to a facility and you're interacting with a doctor or nurses or staff, you're increasing who you're being exposed to. And so again, that's part of the reason that we're taking pause and we're making sure that we're making all the arrangements to be as safe as we can for everybody, so that when patients come into our office, they can feel confident that we've done all the things to make sure to minimize their risk of infection. And then, so in the meantime, while we're waiting or while you're not undergoing treatment, questions about supplements to prepare yourself for IVF. And so good, healthy, clean living, a balanced diet, and moderate amount of exercise. It's a great excuse for us to get outside and exercise now, right? Because nobody wants to sit inside their house all day. But for supplements, a prenatal vitamin that has folic acid is most important. If you have diminished ovarian reserve, there are some supplements that patients can take. Coenzyme Q10, DHA, L-arginine. There's a list of those on our website that you should be able to access if you have questions about that. And then for men, a multivitamin. If you have some sperm parameters that are abnormal, sometimes we recommend some supplementation with L-carnitine and general vitamins that way. But really just good, healthy, clean living and doing your best, okay, to stay as healthy as you can. As for the coronavirus, I know that there are a lot of things that people are trying to take, like super high doses of vitamin C and zinc and things like that. And those things are really not well rooted in science. And so I would caution you from over supplementing yourself with those things. Let's see, what other questions? All right, well, I think the rest of the questions are kind of the same about when we'll get another update. So next Monday, so please look out for a response for that. And as soon as we have any updates, we will be sure to post them on our social media page. With patients that are waiting to undergo treatment, I really do encourage you to call the office with your period in May, because I do anticipate in the next few weeks this is all going to start to open back up again. Our new normal is going to be different. It's going to be, scheduled appointments that are spaced out with limited number of spots for patients during the day to come into the office. We're really going to lean heavily on telemedicine like we've been doing. So consults over Zoom and doing things that way to try and keep patients as safe as possible. But just know that you're missed and that you are never far from our hearts or our mind. And we look forward to the time where we can get back to a normal and have you guys back in our office. We went into medicine and into this specific field because we cherish those moments with you. And so please, if there's anything that you need, reach out to the office. We're here, and I hope to see you all soon. All right. I hope this went okay, because this is not my comfort zone, everyone. So it's great to see you guys. All right. Have a great day. Bye.